The Federal Ministry of Health says it is working to achieve the 2020 Global Strategy Plan of Action Plan for the older population in the country. Dr. Saidu Dumbolwa, Coordinator Package for Improving Quality Care on Aging Population in Nigeria, disclosed this in an interview with News Agency of Nigeria in Abuja in commemoration of the International Day of Older Persons 2020 with the theme, Pandemic, Do They Change How We Address Age and Aging? Dumbolwa said there was hope in terms of health and social support which the government had planned for.
We conducted a need assessment to know whether our healthcare workforce are actually aware of what this healthy aging is all about, that's health and aging. And the outcome of the result came out that we are grossly inadequate in terms of the specialists who are geriatricians and gerontologists in Nigeria. So that actually resulted the urgent need then to actually come with a project to how to go about addressing this issue. And that's how the project came about. And we have 4 thematic pillars. That is 1, clinical care. We have research, we have training of the healthcare workforce, and we have health social support. And as at this moment, I'm telling you that as far as the clinical care is concerned, in the bid trying to align to the health system, the global health system, on how to look for the healthcare of the older persons, we are planning to actually establish regional geriatric centers that will address this issue of gross inadequacy of the healthcare workforce, where we have geriatricians across the country. And at this moment, we have started a postgraduate residency training from both colleges of West Africa and the national in geriatrics. Namely in the National Hospital, University of Benin Teaching Hospital, University of Port Harcourt, and also some hospitals also actually coming up, like University of Maiduguri and AKTS, are planning to actually come up on board on that. And apart from that, also University of College Hospital, which is a pioneer geriatric center we have in the country, actually commenced. They have trained almost over 500 people in geriatrics. You understand, certificate course in geriatrics, which is a very welcome development. Like for instance, in Nigeria, we have over 15 million Nigerians who are over 60 years of age. You understand? So these people, if you look at it, is almost equivalent to 3 to 5 African countries, the population of 3 to 5 African countries. So this is a population that we cannot actually ignore. That is why the Nigerian government is also committed. So the issue of providing formal and informal sector health insurance for the older person in Nigeria is one of the commitment of this present administration. Ministry is actually coming up with a committee that will work in collaboration with several stakeholders, such as the PENCOM, such as the PTAD, and the national unions of the retired civil servant, and the ministry itself, to see how Nigeria will actually come to provide this kind of health insurance for the people, older persons, in terms of the people who have retired from the service to continue with the health insurance, and those people who are actually in the informal sector who have never worked in the government, but you have reached 70 years of age, so that you also benefit from this package of the government that is planning for you. So at this moment, to say that Nigeria is one of the countries in the ECOWAS country that is leading in terms of this global strategy plan of action on health and aging toward achieving universal health coverage for all the persons. We have strategic planned by a healthy aging strategic policy framework that is meant to actually address their issue. And also at the ECOWAS level, we have strategic development plan for 2020 to 2014 in the ECOWAS country. So I'm very optimistic and that the health and social care of all the persons will improve, from the Nigerian plan that we have actually put in place.